was funded, the way it was set up, an autonomous office. So I'm really looking forward to it. I think the thing that's going to be the best asset that we've discussed was, in addition to my work as a judge and attorney, is I served as an adjunct professor trial at St. Mary's Law School for the last 20 years. And I'm already getting a lot of inquiries from young, excited, newly licensed lawyers that are going to want to be a part of this. And so I'm really looking forward to it. I'm particularly looking forward to being here in Kerrville and working with all of y'all. So
we're excited. And so with that, we're going to move on to the rest of the agenda, but thank you, and we want to welcome you.
Welcome aboard.
thank you.
And John, if you'll wait back there, somebody's going to talk to you. Step out there.
Okay.
All good. Thank you. Okay. I see we've got Corey Edmondson from Peterson Regional Medical Center is here with us today. And let's move on to item 1.1 on the agenda, which I know this is something that's on everybody's mind right now. It's a discussion for an update regarding COVID-19. I've got Deb Thomas, Corey Edmondson's here. We've been busy these past few days. So, Deb.
Morning, Judge. Morning, Commissioners. I hope y'all's Christmas holiday was as blessed as mine. Like I told Commissioner Harris earlier, I think my having COVID myself didn't hurt my appetite any, because the pants fit a little tighter and checkbook's still a little lighter as well. But anyway, I hope y'all had a blessed holiday season. So our COVID numbers, the latest update that I can give you is from what we had on Wednesday. DSHS Region 8, it was a state holiday Thursday and Friday, so they didn't put out any information as far as the spreadsheet goes that I usually get, which has a list of everybody that tests positive in Kerr County, whether they're tested at Peterson or CDS or wherever. So on Wednesday, our active case numbers were 475. Total recovered cases was 1,901. We've had 33 fatalities, and as of Wednesday evening, we had 25 hospitalized. We've been notified by the Department of State Health Services that we're about to come up on 7 days of what they call high hospitalization rate. So what everybody has been told is you have to keep 15% capacity for your hospital for COVID surge. Well, it's not really capacity. It's about how many actual COVID patients you have in your hospital, whether it's 15%. So for November 12th, and these are just using the Peterson regional numbers that they give me every day, so from November 12th through December 21st, just for Peterson's testing, we've been running anywhere from 10% to 26%. The RMOC, which is the Regional Medical Operations Center for the Trauma Service Area P, which is what Kerr County is, it's part of 18 counties that are part of TSAP. Our hospital cases for 12/1 through 12/1 through 12/6 were at 15%. 12/7 through 12/8 for 2 days, we were at 17%. 12/9 through 12/21, we averaged anywhere from 10.9%, so we had a drop down to 14.4.
That's a percentage of what?
The patients in the hospital that are COVID positive.
We're going to flesh this out a little bit more.
Well, I'd like to know before I proceed exactly what percentages we're talking about.
Okay, so it's actually the percentage of patients in the hospital that are COVID positive.
So they've gone from it varies.
Yes.
You just said 10% was the last one you said.
10%, December the 9th through the 21st, it was 10.9% to 14.4. From 12/22 to 12/26, it's been at 14.2 to 16.39%. So if we are over 15% for 7 days, we officially go back under the governor's mandate and go back to 50% occupancy.
And just to update you, late yesterday afternoon, I received a letter from the Department of State Health Services, Dr. John Hellerstedt, and we have exceeded the 7 consecutive day, 15% COVID capacity in our hospital. That's why we have Mr. Edmondson here today to talk with us. It's now official. I received a notice this morning from the Texas Alcoholic Beverage Commission that we are now in a high hospitalization category. We're no longer minimal COVID-19. We're in the playing with the big boys now. And all bars are closed, effective immediately. So what we're talking about here on these percentages goes back to the Governor's Order GA32, which didn't apply to us at the time because we were exempted because we were minimal COVID-19 county. But it applies to us now because we're no longer a minimal COVID county. We're now in the high hospitalization. And we are in a trauma service area, a TSA. And when Doug talks about the TSA P, they go A through, I can't remember, S or T or whatever it is, and we just happen to be region P for the trauma service area. And the first calculation that's made is whether or not the 22 counties that comprise TSA P, which is the trauma service area, I'm trying to get that so people understand what we're talking about, exceeds the hospitalizations related to COVID exceed 15% of the cumulative hospital capacity for that region, which means that we have a lot of people in the hospital throughout the 22 counties that we're one of. It starts with the TSA, and then you get considered on the individual county basis. And on Kerr County, we've also been notified that we are no longer qualify for that minimum COVID exemption. We've lost the exemption when that moves us back to 50% open capacity, just like the rest of the state. So where we are with this, and that's why I want to put it on the agenda because we need to talk about it. Dub and I sat in on a conversation with Dr. Hellerstedt last Thursday, I think it was. And at that point in time, they were emphasizing the need to preserve our hospital capacity for the public, that we can't allow our healthcare facilities, in our case, Peterson PRMC, to be overwhelmed. And so they limited it to 15% capacity so that the other 85% is open to the public for basic health needs. Because we don't want our hospital just completely overrun with COVID cases. So I think that's the rationale behind what we're doing. And I apologize for, we asked Deb to come talk to us about this on a regular basis. And it sounds like a lot of numbers, but these numbers mean something. And what it's telling us is, I think I remember in the conversation that Deb and I had not long ago, at the beginning of October, we had, 30 cases?
Correct.
And it doubled by the end of the month. And then November came and we started off with 60 or 70 cases, and it doubled in the first 2 weeks, and then doubled again after Thanksgiving. And in the first week of December, we doubled again in 1 week in active cases. So that's what we're looking at. And the numbers that he's reading off on the 475 active cases, that was as of last Wednesday. I have no idea what it is today. I'm almost afraid to ask Mr. Edmondson what it is, but it is whatever it is. But what we're looking at here, and what Dr. Hellerstedt emphasized to us, is with the vaccine, there is light at the end of this tunnel, a genuine light, and very optimistic about being able to contain COVID-19. But it's going to get kind of dark in January and February, and we have to be prepared for that.
Well, I have a question. I read on the CDC website that they've now decided to put pneumonia, influenza, and COVID all in one category. So that's on the CDC website. So what are we really counting here?
We're counting what's on the DSHS website, which is not anything but COVID.
What I looked at on that website today said positive cases, and it didn't give specifics about whether you're talking about COVID or whether you're talking about something else. So I'm trying to figure this out, what numbers we're talking about, because we had this huge spike after they said they were going to put pneumonia and influenza in the same category. Can you speak to that, Mr. Edmonds?
Sure.
Sounds like we're mixing apples and oranges.
Let's introduce you. This is Corey Edmondson. He's the Executive Director of the Peterson Regional Medical Center. As one of our stakeholders, we meet on a regular basis to share information to try to manage the COVID crisis here in the county. And we will welcome you to Commissioner's Court. I know this is your first visit.
Yeah, it is.
Nobody throw tomatoes, okay? We're not going to do that. But If you would, please address us.
Sure. Thank you, Judge, and thank you for having me, Commissioners. The positive cases that Peterson reports on is strictly COVID patients, positive results that we get from those that we test, and that's what we submit to Doug. And so Doug, I know Doug is tracking what we know what we have locally on a separate spreadsheet and managing that, and also manages what the Texas Department of State Health Services website has. The state's website is behind what we typically have. We're more real time than what the state's website is showing. I think you probably know that. Goodness.
4 hours?
No.
More?
More. Yeah, I say state's probably behind, could be 5 days as far as reporting the number of cases. And so what we report on is real time, and that's to really give us as a community a good business decision perspective versus waiting on the state and being delayed from that perspective. Let me speak to the number of cases in the hospital and how that's looked. I was looking yesterday at STRAC, which is South Texas Regional Advisory Council, which is our trauma service center E. They have, most rural hospitals are hovering way up, well over the 15%, 15% of their patients are COVID. We have 32 patients, it's a new record. 32 COVID patients in the hospital. And if you look at what STRAC has as our staffed bed capacity, which is 88, that puts us at roughly a 37% capacity as far as the number of patients that are.
And Corey, I don't mean to interrupt, I'm trying to be more conversational, because I learned last week when we had our meeting that we have licensed 124 beds in that hospital. So he's talking about a different type of certification from STRAC.
Yeah.
So
We do. We have 124 beds in the hospital. 26 of those are our acute rehab unit. That's our ARU. And the rest of those are med-surg, medical, surgical, and ICU. And the way STRAC likes to look at that is what is your medical, surgical, and ICU capacity. ARU, what we've recently done is convert 4 to 5 beds on our rehab unit to medical beds so that we can continue to take care of our county and the patients being admitted. The last thing we want to do is divert patients or say we can't accept anymore and divert those to San Antonio. We're trying to accept and do take care of as many as we can as a hospital.
And these are all county residents?
I don't know. I don't know that answer. Those could be from out of county as well.
So that would affect our count. You have the hospital limitation, I get that, the number of beds. But this is a regional hospital. It's in the name. It's a regional.
Sure.
So not all those people from Kerr County.
That's true. But they don't.
That's something
that doesn't
they
matter to
consider.
them. It's what is your hospital able to have or do or care for, whether they're from. And we accepted patients from. And so did San Antonio. San Antonio accepted patients from El Paso. We had accepted a month or so ago, a patient from the Odessa and Monahans area to help. Because we had the capacity at that time. We had the ability to do that. Right now, we don't have that ability to accept patients from outside, really, of our area. If they show up to the ED and they are COVID positive and they need to be admitted, and they may be from Bandera or from Gillespie, we're going to admit them and take care of them. So we're not going to transfer them somewhere
Corey,
else.
do you test everyone that goes to the ER?
No, only if they are symptomatic or they have, if they feel like they've been exposed to a positive patient, but they're not experiencing symptoms. We're not going to test them there. We'll send them to either our urgent care center or Kerr Medical Plaza, our primary care site, to be tested. But if they're experiencing the symptoms, we're going to test right there.
No, there's another thing that's come up, and that is that we keep moving the goalposts around, and that's COVID related. The judge used the term a minute ago. I mean, so you're saying that everybody in the hospital that you're counting is a COVID positive person that's being treated just for that,
Correct.
not something else, COPD or something else.
Well, they could have other issues, comorbidities is what we call them.
Right.
But but we're treating them for COVID situation or whatever the case is.
Has that still been incentivized? I mean, there was the $3,500 we heard about per patient and $70,000 if they run an event.
We get a 20% bump in reimbursement to handle COVID-related patients that are CMS, that are Medicare. And still, even at that, that really is not an incentive to accept more or treat more or to say, oh, we want to have more COVID patients. The reality is that doesn't really cover the cost to take care of a COVID patient.
Now, with what we've gotten in a lot of other places, governmental entities have received grants for whatever undue expenses we wouldn't have otherwise.
Sure.
The hospital received them.
We early on under the CARES Act, we received monies to help with those issues and covering expenses and losses and PPE and all the things related to COVID. We applied for those and received those funds.
Are you out of them?
Yes. Yeah, I mean, when you look at the total losses that we've experienced, we've spent now probably $4.5 million in COVID direct related expenses, from the staffing to PPE to supplies to hiring additional staff to care for individuals and all. So we've done that, and then that doesn't count the reduced capacity that we had to have for elective surgeries, when we had to eliminate those. It's been the dollars and millions are they mount.
And part of that time you just had empty rooms, empty beds.
And
Early on, everybody was anticipating this, and
yes.
people couldn't have their elective surgeries, but there was nobody in the bed. There was no.
Right.
So,
Yeah.
how much has the standard changed for Peterson Regional since this began?
When you say standard in regards
Well,
to...
they've said we have, if we have 10 active cases, or if we have this percentage of hospital beds taken up, these kinds of things. Those things seem to be kind of a moving target. It's like trying to nail Jello on the wall. How much of that has changed for you?
I guess to answer your question, we've certainly seen an increase in the total number of patients that we've seen that are COVID related. It's been pretty consistent with how we've managed and treated those patients.
CDC guidelines or what?
That's been a moving target, and we've had to adjust. We've had to adjust some things based on what those new criteria is from a variety of forces. Certainly, we've had to adjust and acclimate to the changes. Organization. We feel pretty fortunate. We understand that we also are one of the very few hospitals in the region that are also doing the antiviral and antibody IV therapy drugs that have come out recently. There's see if I can say this right. Well, we've been doing the remdesivir, but Regeneron and bamlanivimab are IV treated outpatient drugs. And you have to have, people were scared to do those because those patients that were coming in are COVID positive patients. And you have to have an isolated area or a concealed area to treat those patients just because of the infection of it. And we've been able to accomplish that. And so we've been treating patients, and it's helped keep them out of the hospital. And we ran out, we had 14 people on a waiting list. We called the state. They said they had a lot of inventory because a lot of hospitals weren't doing it. And we said, well, send us your inventory. So they did. So we've got a good inventory of treating patients in Kerr County.
That's a therapeutic.
It's a therapeutic. Yeah. They have to meet a certain criteria to receive that. And when they do, the ultimate goal is they get better, and this keeps them out of the hospital.
I'm glad you're here, Corey. There's a lot of talk around the community, or rumors, or what have you. And one of them is, where's the flu this year?
Yeah.
Can you fill us in on that?
Yeah, that's it's really interesting how the dynamics around that. So the Southern Hemisphere in July timeframe, winter time, they didn't experience flu either, really, at any level that they used to in previous years. We anticipated in the Northern Hemisphere to experience the same thing, and we have. I can probably count on two hands how many flu cases we've had during this flu season. And it's just not there. It's out there, it's just not as prevalent as it was.
Of course, the rumor is everything's thrown in the COVID pile, and that's where the flu people
We
are.
test it different. And there's a
Okay.
COVID test, there's a flu test, there's a strep test, there's pneumonia test. There's all,
Sure.
yeah,
Well, like I said, it's out there.
I understand.
We've been told there are two different tests,
Two different tests for,
COVID.
there's the
You have a standard test that.
there's a PCR test, and then there's antibody test that we can do, or the
antigen test.
Antigen test.
The
Get all my
antigen
antis.
test. So the thing I was talking about earlier, that pick column that CDC is doing, were you aware of that?
I'm not familiar with that particular item. Mhm.
Okay, so it looks like to me it's all being dumped in the same bucket. That's what the CDC is saying now.
Yeah, I'll have to look into that a little bit more.
It's pneumonia, influenza, and COVID all together, as listed as pick. And there's an explanation for why they're doing it, but it doesn't make any sense.
Yeah.
A lot of what the CDC has said doesn't make any sense.
But the DSHS numbers, if one could also look at the DHS numbers and see what they are, because
I looked at those this morning.
but the local numbers aren't doing that. I mean, the hospital counts.
Yeah, well, we just found that out from Corey, and I
Right.
appreciate that.
Yeah.
What I've reported, to answer your question, or what's reported to me from DSHS is on a spreadsheet from folks that have actually tested. They're just COVID positive. There's no flu or pneumonia or any of that. This is strictly COVID.
Well, and I want to be clear so there's no confusion. When we first started counting numbers, Doug was the one putting out the numbers, and they were DSHS numbers, DSHS numbers, okay? And they were running way behind what we knew were being tested positive at Peterson. And this was, a couple of months ago, that we decided that the Peterson numbers that were coming back of people testing positive for COVID-19 were more accurate and more current. Maybe not more accurate, but more current than DSHS numbers. And so we started reporting, and Doug's, the numbers that Doug's reporting are numbers that are basically from Peterson. There's some others, but mainly from Peterson, because we found that their counts, when they say people are positive, they're positive.
Well, that's something else I wanted to ask you about. I had a guy tell me this week, he has 2 young employees that had been around someone that ended up testing positive. And they went to Peterson and were told to go home and quarantine, though they didn't test positive. So what's the policy there?
Well, typically, if the recommendation, and even from CDC, if you've been exposed to a positive patient, and you're not feeling any symptoms, the best time to get tested is probably 5 to 7 days after you've been exposed,
Right.
okay? And still, even at that, you may not be symptomatic. If you're not symptomatic, you can still get tested, and we will send you to our Kerr Medical Plaza to get tested. We can do that. If you are feeling symptomatic, you should go to our urgent care center, and we'll test you there. The wise thing to do is, if you've been exposed to somebody, is to go in quarantine until for that period of time, to not expose anybody else. If you're feeling symptoms or whatever, you want to be tested, then go get tested.
Now, does that go into the positive list,
No, not until a result comes back positive.
a confirmed test?
Yeah.
Okay. Good.
I want to go back to something just to clarify between Dub and what the judge said, because I'm hearing 2 different things. And I'm at the meetings, and I know that we're looking at the numbers a little bit differently than we get from DSHS. But Dub's saying he's using the spreadsheet from them to come up with his number. So the number in here is a DSHS number.
It's the number that I put out every day is a combination of DSHS, which includes all the testing that goes on in Kerr County, whether it's CVS Pharmacy or Franklin Clinic or whatever. And then whatever Pam Burton sends me, the infection prevention nurse, sends me every day, I add that to whatever's on the spreadsheet, because it takes 2 or 3 days for whatever positive test comes from Peterson before it lines up on the spreadsheet.
How do you know when DSHS updates their numbers that they're not now included? At some point, they're going to include our local hospital numbers. How do you know to take them off? I mean, how do you?
Because I can look at the spreadsheet, and the addresses that Peterson sends me are included on that spreadsheet. I don't count them anymore.
Because he has more information than we do.
I just wanted to get that out,
Right.
so that it's clear to the public that
It's a
we're not
balancing
counting.
act, and then every 2 weeks, for every 14 days, somebody technically is recovered
Right.
based on CDC standards. And DSHS sometimes is a little slow in removing those, so based on what Pam sends me, I can delete those out.
Well, they changed that to 10 days now, so that's
Well,
another.
I'm gonna stick with the 14 days, to be consistent.
Before we get distracted in how we do these numbers,
Plenty.
and we've been struggling with how to do the numbers from the get-go. We talked about it in our first meeting, Corey. Where we are right now, what Doug is doing with Peterson, is what we think is probably our best guess as to what those numbers are. I can't say that they're absolute, but they're our best guess.
But you're talking about guessing about something that's gonna shut down somebody's business. We don't need guesses, we need really accurate, good information, because you're cutting off somebody's livelihood.
That's the best information available, Commissioner. That's
Shouldn't
all
be
we have.
guesswork.
Well, it's not guesswork.
It sounds like it is.
Peterson's are
We have
positive.
lag time, we have numbers that may be questionable, and you're gonna tell somebody you need to put a closed for business sign in their front window. That's pretty important.
What's pretty important to me right now is that these numbers are absolutely blowing up. How many of them? I don't know. But when you start talking about 500, we're going to be 600, 1,000 first week in January. Active cases that are within any margin of error, reasonably expected positive COVID cases. And we have to deal with it. And the state's told us that we're blowing up, and we're reporting it back to the public so that they know it's blowing up. And it's going to be a pretty bleak January and February, I'm afraid. I don't think Doug or Curry would disagree that we're looking at it's going to get worse before the vaccine slows this thing down.
Charlie, the one thing I'll say, listening to all this, is that the numbers you're looking at are the hospital numbers. Only the people in the hospital
Right.
and their percentage.
Right.
So those aren't guesswork. Those are known numbers.
That's the thing we do know about.
And that's exactly what.
And that's what the
is
state
gonna
shut
shut
us
down
down.
businesses, not our active cases. That's not
Yeah.
what shut down business. It's how many people are actually in the hospital and how many extra beds do they have. That's what's going to shut down our businesses. And there's not any of us can do about those. Those are real numbers.
It's the hospital beds, the actual hospitalizations that have rolled us back from 75% open capacity to 50% open capacity. Hospitalizations.
I think the other thing that's important is that, I don't know, was it 6 weeks ago that we refined the way we were going to track the numbers, active cases, something like that. And it's important, now you mentioned you can go 10 days. It's important that we stay with what we were doing so we can see what the trend is. We can't change the system in the middle of it, then you gotta start over on the trends.
Right.
So we need to stay consistent with what was, maybe even 2 months ago with that new format. I think it would be good, if you can get, at least with the court, that on the graph, or I hope it's on an Excel spreadsheet, something like that, just so you can see what the trend is on a daily basis, how it's going, or at least once a week or something, so that it can be readily available, because we all get questions. And I think the same thing on the hospitalization percentage and hospital numbers. Those are the numbers that are key, and we, as as elected officials, get a lot of these questions, and it really helps if we have the accurate numbers daily, so that we can do it. And we get the DSHS number, but their numbers need timeline. Your number's so much better.
The Region 8 number, which is what that DSHS spreadsheet I use, has over 1,600 names on it right now, or, I'm sorry, not names, addresses of COVID positive patients that we've had here in Kerr County that have tested positive, whether it's through Peterson, whether it's through the mobile testing we've done, whether it's CVS, Franklin Clinic, all of them. So it's pretty accurate. And then the number that I take from Peterson, because Peterson is the only one that notifies me of any testing or any positive patients that they have on a daily basis. I just use that number and add it to it until I find that list of addresses on the spreadsheet, and then I quit counting it. And then 2 weeks later, 14 days, I can delete them off. So it's kind of time consuming, but sometimes I pull my hair out because I can't find an address, but it is what it is.
But that's on active cases.
That's active.
And I want to retreat back to hospitalizations because that's what's affecting us right now. DSHS has told us that we are now in a high hospitalization TSA, right?
Right.
Okay.
The data that I recently looked at yesterday showed that from even the rural communities or counties, on average, are at 34 to 36%. In San Antonio, Bear County, I looked at, they're averaging over the last several days 16 to 17% routinely. So you take that along with what's happening in the rural communities at the 36+%, that throws everything out of whack for our region.
But to break this down so that the public can really understand what we're talking about, you've got 124 licensed beds in that hospital, right?
Right.
Okay. DSHS recognized your capacity at 88 rather than 124.
Right.
15% of 88 is the governor's order. If we exceed 15% capacity, hospitalization capacity, then we have to close the bars and we have to roll back our opening capacity.
15% for a week, isn't it?
7
days.
consecutive days is what it says. 7 consecutive days. And so my math tells me that 15% of 88, if we go by DSHS certifications, okay, it's 13 hospitalizations. And we're at 32. That's a fact of life. We are almost 3 times what the state allows us to be at this point. And what that portends in the future is that we could have our medical facilities overwhelmed with COVID and not be able to treat the public for anything but COVID. And that's what we're trying to avoid. That's what Dr. Hellerstedt was trying to emphasize to us. We've got to do this. We've got to cut it back. We've got to reduce the activity. We've got to re-emphasize all of these safety protocols from CDC and everybody else to try to get this under control so that we don't have our hospitals overwhelmed. And we're working hand in glove with the hospital, who's done an excellent job. And what we're trying to do is to keep the public safe, keep the people safe.
I tell you, the staff is fatigued and overwhelmed with the volume and intensity that these patients require in treating them. It's a little concerning to me as the CEO for the staff, trying to make sure that they are staying healthy and that we rotate them and they get their time off and rest and do all those things. But they've been doing a phenomenal job of care for our community and our county and all the patients that come in.
And to follow up on that, if you would, kind of give us a brief update of vaccines, because I know we've received our first shipment of vaccines here, and we've been trying to get those vaccinations to our healthcare staff,
Sure.
first responders.
So Moderna is the vaccine that we received last Wednesday, and we started vaccinating our employees on Thursday.
Is that the 2-dose?
They're all 2
Moderna?
Both of them are 2-dose. Pfizer and Moderna are 2-dose. Moderna is 28 days between the doses, and Pfizer, I believe, is 21 days between the doses. So we're registering people and getting them ready for their days to come back on the second dose. We don't know when we anticipate the second dose to arrive. We hope we get extra doses, generally speaking, so we can start vaccinating others in the community. Those that are based on the tier levels that CDC has and that the state level recommends. So there's different tiers and who gets the vaccination first. Hospital-wise, we received 500 doses. We should have all of that dispensed by the end of the day. That's our goal. If there's any left over, then we're going to open that up to others and give that and start calling like first responders and those who maybe haven't had the opportunity in those nursing homes. HEB received vaccinations, I believe. The Medical Arts Pharmacy received that, and the state hospital received vaccinations. And hopefully all of us will receive more again, so we can continue to vaccinate our community.
And again, so that the public understands on this YouTube, this is phase one. And phase one is in three parts, right?
Yeah, there's
And A, B,
one
and
A,
C.
B, and C.
I learned this by going to these meetings. They explain all this stuff to me. And phase 1A is the healthcare providers.
Right.
And there's a 1B, I think with first responders, and we get down to 1C, which even includes teachers, of course.
Teachers.
But those are the people that are going to get the vaccinations first. And we can expect those vaccinations probably phase 1A, B, and C through, what, by the end of February or something like that?
Yeah, I'd love to predict a lot of opportunity for when we can vaccinate others. I just don't know. But the general public, my kids, for example, when would they get the vaccine? It's going to be late. It's going to be March probably
Yeah.
for them.
So the general public's not going to really be able to get vaccinations probably until the spring.
Probably
Something
so.
But I think it's important that the people understand what we're looking at on the timeline here. We're doing healthcare, we're going to do the nursing home staff, we're going to do first responders, we're going to do teachers, we're going to do the people that are most exposed right now. And then we'll go to the next phase, which will include us. And I think phase C includes the older people with comorbidities, right?
There's 65 and older. They're even looking at some of those. As I recently received some information that says even for people who are 65 and older with comorbidities, potentially could get this in tier 1, phase 1.
But for the general public, we're looking at probably early spring.
Right.
Have you had anybody?
Judge, can you repeat what he said about people over 65?
You resemble that?
I couldn't hear Corey very well.
He's saying that, and I'll use myself as an example because I'm over 65. Substantially.
Okay, thank you.
But
I was asking that for you.
yeah, okay. I resemble that remark. But it would be available to older people with comorbidities. That would be phase 1C, where they would be included right before the general public.
The challenge with this is keeping up with all of it and allowing, as they learn who's getting vaccinated, who's receiving it, who's accepting it, and who's not, then they start opening up to earlier, vaccinating others who they didn't maybe anticipate until late in the process, but depending on how many vaccines are available and who's taking it and who's not. So those who are 65 and older are considered some of those vulnerable individuals who would get it sooner rather than later.
Sure.
Are they still recommending, or are they recommending that if you've already had it, that you wait on getting the vaccination to the end? That's what I heard CDC recommended.
Yeah, we not the clinical expert on that, but what I've learned is whether you've had it or not, still getting the vaccine is fine. You should get the vaccine, whether you've had it or not.
Well, they were just talking about in order to give those that hadn't had
Who
it
hadn't
first,
had it.
the
Yeah.
ones that had some immunity.
It seemed like the right thing to do for people, right? Yeah.
So the trigger is 13 beds for our county.
Or it's 18.6 if we go off the 124 license beds.
But they're not using
I'm
it.
following the numbers both ways. 'Cause I know we got beds.
DSHS is using the number
They're
88.
using the radiate.
So 13 beds for a county of 50,000 people, 60,000 people. And we don't know how many of those people, and you're at about twice that right now, that are hospitalized. We don't know how many of those people are coming from other counties. It's a regional hospital, so a lot of them are. I say all of this so that people watching at home and that the citizens of Kerr County will realize that not all of this is coming from Kerr County. Just like we saw the big spike in El Paso from people coming across the border, that didn't reflect El Paso County. This doesn't necessarily reflect the numbers of Kerr County. It still creates the same problem for us in practical matters because your hospital has too many beds full of people that tested positive specifically for COVID.
Correct.
Okay. I want to make sure people understand that.
I got another question, with this vaccine, healthcare workers get it first, it's understandable. Is it optional or mandated?
It's optional. We're not mandating individuals get vaccinated. And I would say that We're probably 54% of those frontline staff that said, yeah, I'm going to take it. That's when we did an early survey. Once people started receiving that Thursday, we had more coming out and saying, oh, I want to get vaccinated. So I don't know right now what percentage of our frontline staff have accepted the vaccination, but it's not mandated.
They wanted to watch the others at once.
Exactly.
You go first. You hear that, Tom?
Okay. Well, Corey, I want to thank you for coming.
Sure.
This
Thank
has
you.
been
Thank you
unprecedented.
for having me here. Happy
Yes.
to come anytime you would like me to. So
Thank you.
We really
Okay.
appreciate
You
you
bet.
bringing the information to us.
Thank you.
Thank you.
Okay. That took a little bit longer than we expected. Is there anything else that we need to go over, Deb?
Judge, I just wanted to kind of recap the GA 32 governor's order. For 7 consecutive days, my conversation with RMOC yesterday was Tuesday will be, if we hit over 15% on this Tuesday, that will be our 7th consecutive day. And the order will go into effect on Wednesday.
That's tomorrow.
Yes, sir, that's tomorrow.
That's not
We got
like,
32 in the
It's
hospital.
not likely, no. And it's for the TSA, so we're at 16.9% yesterday evening. So I don't expect it to go down. So in order for us
people
to,
get out of the hospital, that makes a difference.
in order for us to go back to 75%, we'll have to have 7 consecutive days under 15%, 15% or under.
Is it 7 or 14? Is it
I thought it said 7 days.
That's a lot.
So, Deb, to be clear, the 50% capacity would start on Wednesday.
Correct.
Bars have to be
Bars,
closed
restaurants.
starting Wednesday.
Back to 50%, bars would have to close.
That makes no sense to me. That the
Everything
fire
else
knows
is
to go to the bar. That's never made any sense to me.
Yeah.
If you have 51% of your sales alcohol, you gotta close down. 50% is okay. Because the virus knows these things.
I agree that makes no sense.
Makes
but
no sense at all.
Unfortunately, we don't have the luxury of,
I know.
Yeah.
That's our.
The governor has
governor.
revoked all the emergency powers that I had to do anything about that.
I know.
So,
I'm sorry, guys.
okay.
I'll keep track of it as best I can, Judge, and I'll keep you all informed.
Good.
Appreciate everything you're doing.
Yes, sir. You have a good day.
Thank you, Doug.
Okay, on that note, we'll move back into our regular agenda. Item 1.2 is to consider, discuss, and take appropriate action. A request to close Flat Rock Park, not the dog park side, to public parking from February 11, 2021 at 11 p.m. until February 14, 2021 at 5 p.m. for the use of stock show trailer parking for the Texas Pork Producers Elite Showcase. Public access to the dog park would be allowed from the walk-through gate near the bridge. Brandon Gunn. Yes, sir.
Morning, Corey. Appreciate the opportunity to come and visit with you. And we have been planning for the last year, since we ended back in February, the 2021 event, our swine show here in Kerrville. It's a great venue. It's a great county, great area, region to work with. Everybody's been extremely welcoming. And so we look forward to working with you through everything, our plans, COVID safety plans, and how we expect to provide a safe environment for everyone that attends.
on the start, I mean, I met a month ago, 3 weeks ago, I met with the Ag Barn, the pork commission and Jake. And things have gotten a lot different since then, these two agenda items. You know, I think that we're gonna have to ask, hopefully we'll do the show, but it may have to be reduced some. I know you've already reduced it a lot, and I think what's the date, is 21?
February 11th
February
through
11th.
14th.
I think it needs to be probably back on our agenda in our first meeting in January. I think we can take action on this to close in the park, but I think it needs to come back at that first meeting in January and see where we are. I feel a lot more numbers, and I recommend we continue. You need to be aware there could be some severe cutbacks in how you have to do the show.
You planned for this a year.
Yes, sir. That's the thing, the leadership, and I don't want to take any situation lightly. I understand it fully, and that's why we're prepared. And it's not a surprise or shock the current state that we're in. This is kind of where we assumed that we would be. And so that's what we have been planning for. The leadership of our organization, in event planning specifically, the experience that we have even over the last 9 months with putting on other shows and events around the state, whether it be stock shows that we did back in the spring of this year, the ones that we're planning for February beyond this one, another one in Fort Worth. We did a large show in Lubbock a couple weeks ago.
You just adjust to where you're at.
Yes, sir. We put on multiple events throughout the year, and so we've been involved and have the leadership and the individuals working with us that have put on these events. And so when we look at the safety plans through all the various documents with CDC and the recommended protocols, we have been prepared and ramping up to exceed those and alter our events to make sure that we provide a healthy and safe environment for everyone that attends.
For our facilities out there, our show in January should be a good test as far as how things go. Don't you agree, Jake? And, might offer some guidelines, because every place that you have shows is set up a little bit different and what have you. So
True.
that's a good test.
It provides a great opportunity. We will be in attendance. I was in attendance for the large jackpot show that took place a couple months ago, the Tosh Memorial Jackpot. And because of that, we've made some alterations to our plans in terms of single entry, single exit points, trying to establish design and flow to limit spectators and buildup of attendees. We've also made alterations to our schedule in order to provide increased window times for arrival to spread things out as well.
Good.
Well, I move for approval.
Second.
Motion's been made by Commissioner Baloo, seconded by Commissioner Harris to approve the request to close the dog park, or close Flat Rock Park, not the dog park, February 11th through February 14th. Any other discussion? Those in favor, raise your hand or say aye.
Aye.
Okay. That would be 4, and I'm going to abstain. Brandon, I'm working with the stock show on January. I don't know if the public understands that you're requesting a mass gathering permit. A mass gathering permit is for gatherings of 500 people or more. That is presented to me, and we'll set a hearing for that. But at this point, I'm taking a look and see how we're doing. The stock show people have been in touch with me on a regular basis. They're being very, very responsible. And I know that they're in touch with you also. But we'll be monitoring that as we go forward. So at this point, I'm not taking a stand one way or the other. I don't know if we're going to be able to do it or not, but we want to do everything we possibly can.
I appreciate that, and look forward to working with each and every one of you on our plans. We'll go to any measure to make sure this show happens. And that's what we promised our people, and so we will carry that out and look forward to your recommendations, and we'll work with you on every bit of it.
Look forward to that. Okay, the next item on the agenda is related to you also, 1.3, which is to consider, discuss, and take appropriate action to appoint a member of Commissioners Court or designate a person to perform an investigation under Section 751.005 of the Texas Health and Safety Code for the purpose of determining if the minimum standards for ensuring public safety and order are prescribed by law will be maintained under the application for a permit for the mass gathering by the Texas pork producers scheduled for February 11th through 14th, and hearing set for Tuesday, January the 26th is when we have our hearing. What this is this is going to be, there will be a hearing on January the 26th for the mass gathering permit. Right now, that's the only pending application for a mass gathering permit that we have. And we appoint somebody from the court to conduct the investigation. And customarily, it's one of the liaison commissioners for the Youth Event Center that works with Jake to do that. And then we will have a hearing. It will be a public hearing on the 26th, which they will report. We'll have reports from the fire department, from the sheriff, and from everybody else's with regard to the public safety. So
I've already been working with them about this. I'll be glad to be the commissioner on this one.
Okay, so I'll nominate Commissioner Letts to be the investigating commissioner.
Second.
Second by Commissioner Harris. Any further discussion? Those in favor, raise your hand. Say aye.
Aye.
Unanimous, 5-0. Thank you.
Thank you, guys.
Okay, item 1.4, consider discuss and take appropriate action to declare an office chair as surplus and dispose of properly. This is with the Environmental Health Office.
I'm busy with Reagan on this. It's just a chair that needs to be surplus and disposed of. It's a worn out office chair. I'll make a motion to approve the agenda item.
Second.
Motion's been made by Commissioner Letts, seconded by Commissioner Harris. Can surplus the chair as presented. Those in favor, raise your hand. Say aye.
Aye.
Unanimous, 5-0. Next item is 1.5, consider discuss and take appropriate action to accept donations of multiple items from the Tally Elementary School Student Council.
I visited with Reagan on this one as well, and the Tally Elementary School Student Council helped organize it, and the picture was in our packet of a lot of the items that they donated for our animal control facility. A lot of animals for, packages of treats, kitty blankets, cat collars, cases of canned dog food, dog toys. That's just part of the list. It's a long list that was attached to the agenda package, and I'll make a motion that we accept the donations from the Tally High School kids and thank them for their civic mindedness.
Second.
Motion's been made by Commissioner Letts, seconded by Commissioner Harris, to accept the donations from the students at Tally Elementary School Student Council. Any other discussion? Those in favor, raise your hand or say aye.
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 Unanimous, 5-0. Next item on the agenda is 1.6. Consider, discuss, and take appropriate action to approve renewing the Kerr County Incentive Program as part of the Texas Association of Counties Healthy County Rewards Program for 2021. Ms. Holden.
Good morning. This will be the third year that I come to you to ask you to do the incentive for the employees. If they complete 3 of the 4 Healthy County challenges and get an annual physical and provide proof to HR, they could get an extra paid day off in the following year. So that would be for 2022 that you'd be approving today.
How's that going?
We had 28 from our partial list earlier this month that completed 3 of the 4 challenges. I don't know about the HR's collecting the information on the wellness exam, but we may have 28.
28 people that did it all year? Is that-
Yes,
You sign it, you do it all year?
yes, 3 of the 4 challenges.
What are the challenges again?
They're the steps. You need to walk a
Okay,
certain number
yeah.
of steps per day for the time period.
I move for approval.
Second.
Motion's been made by Commissioner Harris and seconded by Commissioner Letts to approve the Kerr County Incentive Program as part of the TAC Healthy County Rewards Program. Any other discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0. Item 1.7, consider, discuss, and take appropriate action on a request for disbursement of salaries and routine office expenses to rescind court order number 37520. Ms. Holden.
This is on the agenda because now that you are meeting twice a month, there may be expenditures that need to be paid prior to the next meeting. And so the auditor and I are requesting that the items on this list be available for us to pay if necessary. We don't see ourselves paying weekly, but in case something came up that was on this list that needed to be paid, we could and then present it to you at the next meeting.
I move for
I move for
approval.
approval.
I second that.
Okay, motion's been made by Commissioner Moser, seconded by Commissioner Baloo, to approve the request for disbursement of salaries and routine office expenses and to rescind court order 37520. Any other discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0. Item 1.8. Thank you, Ms. Holden.
Thank you.
Consider, discuss, and take appropriate action to recommend the appointment of Jonathan Letts as a member of the Region 11 Guadalupe Regional Flood Planning Group and authorize county judge to submit a letter stating the same.
Did we talk to his wife first? He's on a lot of committees.
Let's nominate him before we talk to him.
We've talked about this before several times. I've visited with Commissioner Moser a little bit about it as well. And it would be very helpful to Kerr County to have a member on that. They have decided to expand to bring in one county representative into this planning group, one additional county member. The current one they have, I believe, is from Guadalupe County. The upper area of the Guadalupe Basin was almost left out of the planning group, and probably one of the more critical areas, at least in our opinion.
Sure.
So trying to get someone put on that committee. Ray Buck is also hoping to get his name added as well under a River Authority category. The idea would be I'll draft a letter, work with a judge on that, and that's why it's worded the way it is, and for the judge to submit the letter.
Just weighing in, I think it's crucial that this part of the Guadalupe River be represented on any
Oh, without a
floodplain.
doubt.
Absolutely.
So,
I move for
and
approval.
I appreciate you volunteering to do this. It's just one less thing the rest of us don't have to do. So, do we have a motion?
Yes.
Motion is made by Commissioner Harris,
Second.
seconded by Commissioner, okay, seconded by Commissioner Baloo, to appoint Commissioner Letts to the Guadalupe Regional Flood Planning Group. Any other discussion?
How does this interplay with the region, Jay?
Not at all.
Not at all. Okay.
The chair of this group is former state representative Doug Miller. And we do have one representative from Kerr County on it right now, Joseph McDaniel, who heads up this region, Aqua, Texas. They had the same categories to fill, which really doesn't make a whole lot of sense to me the way because water utilities don't have a whole lot to do with flood planning, but that's the way the state wanted to set it up. So, and Joseph has been very helpful, keeping me advised, Ray Buck, and I think Tom advises of what's going on. Hopefully trying to get somebody else on the committee from Kerr County.
Okay. Anything else? Those in favor, raise your hand or say aye.
Aye.
Aye. Unanimous, 5-0. Item 1.9. I'm going to try to take a break before we get to the 10 o'clock items. Consider, discuss, and take appropriate action to determine liaison positions for 2021 and review liaison policies. Nothing new here.
I think we kind of did a
Move for
little.
approval of keeping them the same as we had last year.
Second.
Okay. Motion's been made by Commissioner Moser, seconded by Commissioner Letts, to approve the liaison positions the same as last year. Any other discussion? Okay, those in favor, raise your hand, say aye.
Aye.
Unanimous, 5-0. Item 1.10, consider, discuss, and take appropriate action to appoint Chris Hughes as president of the Emergency Services District Number 1.
Okay. Due to several things, their ESD number 1 audit did not get turned in time for years 2019/20.
But it's not because they're broke. They have plenty of money.
And there's a lot of factors in this, but the law states that the president and treasurer must be replaced. Okay, and I received a letter of resignation from Chris Hughes, the current president, and and we're not going to accept it. So I move that we reappoint Chris because to the ESD number 1 president slot.
And I'm going to second
Bill
that.
Aycock was.
And then-
Let me just weigh in.
Yeah.
This is a technical glitch,
Yeah.
okay? Through the pandemic and all the quarantines and this and that,
Sure.
missed a deadline by a date,
Correct.
and we're supposed to remove the officers. Well, they resigned. We want to reappoint them because there's nothing bad about what happened.
Yep.
And so that's why I second. Chris Hughes has done a great job with this, and we want to keep it out.
Oh, without a doubt. And to go forward, what you were saying, Bill Aycock was appointed as treasurer.
Yeah. Okay.
Yeah. But anyway, so it's kind of no harm, no foul type deal, and it's common. A lot of things, COVID even related to some of it.
Well, and I have to take some of the blame because I'm the one that said Chris Hughes working so hard on the capital improvement planning committee.
There you go.
Get it in
There you
time,
go.
so,
So,
And he did a really good job.
Yeah.
He did a great job with everything.
He was a great leader.
Great volunteer.
Right.
Okay, any other discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0.
Is there a motion in the second one?
He made the motion and
Yeah,
I
I made
seconded.
one.
Sure.
1.11, consider and discuss to take appropriate action regarding employee merit pay. Commissioner Moser.
Thank you, Judge. In light of the fact that none of our employees, to the best of my knowledge, has suffered unemployment because of COVID, and the fact that every family in the county of 4 roughly received about $5,000 this year, and potentially another $5,000 if the $2,000 is approved for each member of the family of adults. We're bringing everybody up to $5,000 to $10,000 per year, and our merit pay is $25,000 we've set aside in the budget. I'm going to make a motion that instead of the county residents paying merit pay to county employees when they receive this much from all of the taxpayers throughout the nation, that we not have any merit pay, which is for the fall previous year. So my motion is that we suspend any merit pay for county employees.
For this year only right now.
Yes, that's correct.
Okay.
I second that.
Okay, the motion's been made by Commissioner Moser, seconded by Commissioner Harris to suspend merit pay for 2021. Is that right? Okay.
Correct.
Any other discussion?
I have a comment. I mean, I'm in favor of it. I'm fine with suspending it. But we really need to work on a process that we have in place well in advance.
I agree with that. I just didn't want to take this off the table for the past year.
Because I think we need to, we need to look at it, see how to work, maybe talk to some other counties, see how they do it. I think it's a good policy, but I'm fine with suspending it for this year.
I don't want any county employee to feel like we broke faith with them in any way.
No, it's not that.
Whether this was a bad year or not, and whether, if Dad slips me a 20 when I'm at home from college, and when one pocket and Mom slips me a 20 in the other, am I at fault for that? Have I not still been a good kid, a good student, to come home and see them? So I feel like that when we entered into this year, maybe some doing their very best, hoping to be chosen for this, that we might be breaking faith with them. To suspend this because they were fortunate enough, unfortunate also, to get this other stuff. To withdraw this now seems a little petty to me.
I don't think it needs to be withdrawn because of the federal funds. I just think that we need to have a process
I agree with that.
that we don't have, and this is for the previous year. It's not for the 2021, it's for 2020 budget year. So, I just think we need to
That's
come up
correct.
with.
It's for the previous year.
And it's not eliminated
Right.
going
Well,
forward.
I've said my piece.
Any other discussion? Those in favor of suspending the merit pay for 2020, raise your hand or say aye.
Aye.
That's 2. Those against? 1. Abstentions? 2.
The 2 carry-in.
Well, we've got a quorum of 5 people, so in order for it to pass, we have to have 3 votes that we don't have.
We had an abstention.
Well, let's
Are
see.
you abstaining?
I think
We went through this a while back.
Yeah.
For the county
So
attorney,
it's just the 3?
last time, when they abstain, those that are voting, it goes based on those that are voting. So it's 2-1 in favor.
Okay, so 2-1 in favor. That'd be the ruling.
Passes.
Okay, with that, let's take a short break, be back here as close to 10:15 or so as you can. We have several timed items at 10 o'clock. And then I believe I've got a timed item, executive session at 10:30, so we'll take those in order. So the next item on the agenda is 1.12, a public hearing for the revision of plat for estates at Turtle Creek Section 2, lots 27 and 28. This is a public meeting, public hearing, and it will come to order. Is there anybody who would like to address the court for the public hearing for a revision of plat for estates at Turtle Creek Section 2, lots 27 and 28? Okay.
Judge,
Yes, sir?
I move for approval for setting the public hearing for the date specified.
This was the
This
hearing.
This is the hearing.
Oh, this is the hearing, I'm sorry.
Okay, so,
Looking at the wrong agenda.
no, okay, there being no one appearing at the public hearing will be adjourned. We'll move on to agenda item number 1.13. Consider, discuss, and take appropriate action for the court to set a public hearing for 10 a.m. on February the 8th, 2021 for a revision of plat for Paradox Retreat Lot 1. There's Bob.
Yes, sir. Good morning. This proposal divides Paradox Retreat Lot number 1, currently 11.59 platted acres, into 2 lots. Lot 1A will be 5.17 acres, and Lot 1B will be 6.45 acres. Both lots will front FM 1340, and proposed driveways will require permits from TxDOT. Both lots are in the floodplain and must meet floodplain requirements for development. The county engineer, Charlie, requests the court set a public hearing for 10 a.m. on February the 8th, 2021 for a revision of plat for Paradox Retreat, Lot 1, plat file number 146816 and precinct 4.
I move for approval.
Second.
Okay. Motion been made by Commissioner Harris and seconded by Commissioner Letts to approve the setting a public hearing for 10 a.m. on February the 8th, 2021 for a revision of plat for Paradox Retreat Lot 1. Any discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0. Item 1.14, consider, discuss, and take appropriate action for the court to set a public hearing for 10 a.m. on February 8, 2021 for a revision of plat for Kerrville South 2, Lot 50.
This proposal divides Kerrville South 2, Lot 50, which is currently 6.51 acres, into 2 lots. Lot 50A is proposing to be 2.34 acres, and it will front on Marshall Drive. Lot 50B proposes 4.17 acres and will front on Kerrville South Drive. The asterisk there says the proposed lot sizes will be smaller because currently an easement exists, and they will be dedicated right-of-way, which will make the lots get a little bit smaller than what is shown on your current proposed plat. The county engineer requests the court set a public hearing for 10 a.m. on February 8, 2021 for a revision of plat for Kerrville South 2, Lot 50, Volume 4, page 64, Precinct 1.
I move for approval.
Second.
Motion's been made by Commissioner Blue, seconded by Commissioner Harris to approve setting the public hearing for revision of plat for Kerrville South 2 for February 8, 2021 at 10 a.m. Any other discussion? Those in favor say aye or raise your hand.
Aye.
Unanimous, 5-0. Item 1.15. Consider, discuss, and take appropriate action to disqualify, reject bid due to late arrival.
Yes, there was one of the bids arrived that we did opening the bids at our last meeting for metals and emulsions and rocks and all that. And I just wanted, I thought it would be best probably at this with Kelly and Charlie about this, that we officially reject this one bid. Is from Wilson Culverts, who has bid on our many times, but their bid did receive or come in late, and we should reject it, in my opinion. So I make a motion that we reject the bid from Wilson Culverts due to its late arrival.
Second.
Okay, motion been made by Commissioner Letts, seconded by Commissioner Harris to disqualify and reject the late bid from Wilson.
Wilson Culver's.
Wilson Culverts. Any other discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0. Item 1.16, consider, discuss, and take appropriate action to award the Road and Bridge Department annual material bids for road base, cold mix, aggregates, emulsion oil, corrugated metal pipe. Ms. Hoffman.
The Road and Bridge annual material bids were read aloud on Monday, December 14, 2020. We usually award them on the same day, but there were a lot of bidders, and we felt it was best to bring the information back to the office to evaluate, put together a spreadsheet regarding the results to ensure accuracy in the reporting of the results. I have before you the spreadsheets with the results on the bids and last year's number for your review. I'll just kind of briefly go over it. On the culverts, we didn't have any bids, even though that one was late. Since we stopped doing the driveway installation, we don't purchase near the amount of culverts that we have in the past. So really, I have a feeling that's probably why both culvert companies, Contact and Wilson, probably did not bid. We will continue probably to leave them on our bid list, just in case we run into something to have a bid price. But that's that first page. Your second page, and it will kind of help with the map page that I also handed out to you. You have all your different bid numbers. And you know, some of these bid numbers, especially the ones in San Antonio, they look like the prices are very, very low. For instance, the one that's 5 down, Martin Marietta, you gotta go to San Antonio to pick up the stuff. So by the time you do that, you're not getting the material for a very cheap price. We have 3 main quarries here that we use that are all pretty much, might be in Gillespie, just over the Kerr County line, but we have Wheatcraft, Allen Keller, Rogers Pit, which is up off of Harper Road, and then you also have Edmund Yansky has a pit that's by I-10 and 27. Those are the 3 main pits, and it just kind of depends where the project is located on our base material and who we're going to get it from. We've got a lot of work out in Precinct 4. We're probably more apt to go to the Yansky pit or the Allen Keller. You get out in Precinct 3 and 2, it might be the Red Rose pit with Wheatcraft. So that one has always kind of been a question, I know, in the past with the commissioners. So I did maps, and you can also see the other pits that bid. One was out of Austin, and it was about a 2-hour drive. And so you can kind of see on the base materials that the price may look good, but by the time we get done picking up from a location like that, we've spent a tremendous amount of money and wear and tear on the dump trucks. If you go to page 3, your emulsions, you'll see for the CRS2, Ergon won that bid at $1.92 per gallon. We're also going to start using the CRS2P, and the 2P has polymer in it. You can actually take this stuff when it's down on the ground and pull that emulsion, and it'll pull a string. It's almost like a rubber band. We used it on the hill in Northwest Hills. We've used it on a bunch of the hills. Bandera County uses it, Gillespie County uses it, Kendall County uses it. It has better rock retention. We've had a lot of problems with getting the rock to stick, and we think it's because of the CRS2P, or 2. So we're going to probably use both of these, and we had really good results last year with the polymer. Your AEP, this P squared, $2.04. We've started to use the next row over, the CSS 1H, in place of the AEP, and Ergon won that at $1.92 a gallon. No bid on some of this stuff. The vendors just place their materials in there. We don't actually make the request for some of these. In these last 5 columns, we didn't make requests for. But that MS-2 is a fog seal type material. We currently are not doing fog seal. It might be something we may look at once we catch up and actually get us into a true maintenance program to do a fog seal. It's, the city did a bunch of it. They place the emulsion down, and they don't, a lot of times don't put rock down, and they put a surface of oil down, and it's a different makeup of the oil, and it helps to kind of seal micro cracks and things like that. It usually will gain you about 2 or 3 more years on your surface. So, kind of, yeah. It's an emulsion. The thing that is hard for us is a lot of our roads, we can't reroute people, and your re-entry time sometimes is 45 minutes. People throw a fit at sometimes the 15 or 20 minutes when we're trying to get the oil down to put the rock down. So that could be a problem for us, making people wait 45 minutes before they can actually get back on that surface. And then you had a TR fog that was from Rite Asphalt, $2.16 a gallon, and then no bid on this MS18 TR. When you go into your black base, we had Vulcan Materials won the bid. Nobody else bid on that. $58.54 a ton. This is our most expensive material that we use. The CC is generally what gets put in potholes. The next column over, $58.54 a ton. Type A, AA, your AA is a lot finer material. 64.54. This is a plus. It's got an extra bond material in it. We haven't used it, but they decided to put that in for us. And then the asphalt, the type CC plus, 64.54 a ton. Type D, it's going to be usually your bigger rock with the asphalt coated onto it for adhesion. $61.54 a ton. And then a cold mix D plus, it's like those other, the AA and the CC, 67.54 a ton. And then Wheatcraft set up a hot mix plant, and they put hot mix type D in here at $65 a ton. We probably won't be doing any hot mix. You have to have special equipment usually to lay down that hot mix. But anyways, they threw us a number, and that was fine. Then you get to the last page. This is our paving rock, the trap rock that you've got, and that's what we used to use. $60 a ton for the grade 3, and $60 a ton for the grade 4. And then Vulcan Materials, $69.51 for the grade 3 and $41.51 a ton for the grade 4. Grade 5, $40.51. We have kind of switched and gotten away from that black rock just because of the expense. That's not to say that if we had a really, really steep hill that you really needed the traction control, that we might not get, a couple loads to do a hill. So we've remained, putting that on our bid list. But the lower boxes is really what we've been using. You've got Wheatcraft with the crushed uncoated white rock grade 3, $25 a ton. Grade 4, $25 a ton, and grade 5, $25 a ton. The uncoated white rock that's not crushed, it's $20 a ton for the grade 3, $20 a ton for the 4, and $20 a ton for the grade 5. So those are usually the two that we've been purchasing. We also purchased from Allen Keller. $35 a ton for the uncoated white rock grade 3, $35 a ton for the uncoated white rock grade 4, and $35 a ton for the uncoated white rock grade 3. We want things delivered. Wheatcraft, If they're gonna deliver their uncoated rock, the crushed or the uncrushed, for the trailer is $4.90 is added on to that unit price of $25. If it's gonna be a tandem axle dump truck, it's gonna be $6.80 a ton added on to that $25 price. Alan Keller, no delivery price on that. So,
Kelly, can I interrupt you for a second?
Absolutely.
While we're talking about this black rock, white rock stuff, and this white rock's running this basically half what the black rock runs, and that we've used that on many streets. Y'all used it on my street a couple of years ago, and it looks like a lot of people get alarmed. They think it's caliche. Well, after a couple months, it looks just like the other does, virtually, and people get alarmed. So, but we're saving about half the money.
yes, and that was a way.
Stretching the taxpayers' money is what we're
Yeah,
doing.
and that was a way for us to, because we really were doing about 25 to 30 miles a year in our seal coat, which put us on about a 19-year cycle. And your oils are only gonna last about 7 to 10 years. And so that's why some of our roads are really starting to show some base failures, some pretty significant cracking, things like that. And so I've come to the Corps, we're going into our 4th year on our shooting for more like about a 45 to 50 mile a year program to get you back down to a 10-year cycle, and that's where you really want to be. And that was a way to fund the shortfall on that, was to go with this rock. And I think it has done well for us. I know that there's been a few locations that they haven't particularly cared for it, but nothing really has changed in our process. I think people get accustomed to that black looking rock, but really in the end result, it's pretty much the same oil, same process.
And we're buying local.
Yes, supporting local. So at this time, I ask the Commissioners Court to accept all material bids, annual material bids for the Bridge Department.
I move for approval.
Second.
Commissioner Harris made a motion, seconded by Commissioner Blue, to approve the annual material bids for Road and Bridge. Any discussion?
I just want to say, I enjoy this as much as anything we do. Seriously. I'm serious.
That's good.
Well, you know, I want to commend you, Kelly, because you break it all down. It's easy to follow. It's very important. Our roads is one of the main things we're starting to take care of. And if I heard you right, you're going to pave all the roads at least twice before you retire. Did I hear that right?
I hope so.
Okay. All right.
But I do want to give a shout out to Vicki. Vicki is the one that set up that spreadsheet, and we both worked on it together this year to try to even make it a little bit easier for everybody to understand. It was hard to read in the last few years, and you all had asked different questions in the last couple of years, and so Vicki and I sat down and tweaked it a little bit, and then we went and did a map quest, so you could actually see the locations, and it gives you the mileage of how far you got to drive to go get that base material. So you start to kind of understand why local on that base material is the cheapest way to go. So.
I think it's important to point out, and correct me if I'm wrong, Kelly, aren't we one of maybe 4 counties in the whole state that every county road's paved?
Yes.
That's a rarity, you know.
Yes, our neighboring counties
Exactly.
don't have all their roads.
A lot of collegiate roads.
Yeah, right, you're absolutely right, they don't. So, yeah, there's a lot to be said for that, and that has every bit to do with people that you've had in the past. They were the ones that got all the roads paved, so I feel like our job now is to continue the maintenance on them, and hopefully in about another 6 years, 7 years, you can really say that we truly are on a maintenance program, because I haven't really felt that we've been in a maintenance program. Maintenance program is you get there about every 10 years, get back and put a new, so you don't have these cracks starting to form, and you start getting base failures where you're having to purchase a lot of base, because you have to rebuild everything up underneath. So we get back sooner, and we put one coating of oil and one coating of rock down, and that's it. Because anytime you do a total reconstruction, it's got to be two. So 2 layers of oil, 2 layers of rock. So you've just doubled that cost there. So,
Yeah. And a lot of your work is based on the weather.
yes,
Yeah, so
very
you
much.
never know.
We were lucky this past year.
Yeah.
We did real well last year on what we ended up getting done, and it was because it was so dry.
How many miles did you get done last year?
43. 50 is really hard. We've got a lot of new people, and we've had a lot of key people
A lot of
retire.
people out.
Yeah.
Just from
Yeah. So,
quarantines and
but I was
stuff.
really proud of them last year because we had some people retire. We had one guy that had surgery, and he's a real key person. He was out for a couple months, and we hit the most that we've hit was this past year, and we were 4 to 5 people short. So I guess what I'm getting at is give us a few years and get us fully staffed. And I truly think with the weather cooperating, we can hit that 50 mark. I think it kind of proved it to them this past year. We were short-staffed and we actually got more done than we've ever gotten done. So, just good.
I've said it several times, y'all make us look good.
Appreciate that. I'll share that with them. Thank you.
Okay, any other discussion? Those in favor, raise your hand and say aye.
Aye.
Unanimous, 5-0.
Thank you.
Thank you.
Thank you, gentlemen.
Approval agenda, 2.1, pay bills.
Yes, the disbursements for the court's consideration are Kerr County, $423,032.06. Adult probation, $5,977.10. Airport, $4,163.76. Juvenile probation, $28,325.94. Fund 51 water claim, $146.25. Fund 78 county clerk fees, $1,665.60. Fund 88 county attorney hot check fund, $1,600. Fund 95, which is the 198 DA forfeiture, $658.87.
James, this juvenile, is that primarily transport? It's all for me to read most of this. So.
Let me get to that one real quick.
I need girl glasses, these are Dollar Tree.
Magnifying glass.
I need magnifying glasses. Well,
Most of them are for
gave me one
detention
tonight.
Attention.
and other services they provide for counseling.
You have a motion yet?
Nope.
No, I'll make a motion, we approve the disbursements as presented.
Second.
Motion been made by Commissioner Letts, seconded by Commissioner Harris to approve the bills as presented. Pay the bills as presented. Any other discussion? Those in favor, raise your hand and say aye.
Aye.
Unanimous, 5-0. Budget amendments,
There are none.
late bills.
Yes, we do have 4. That total is $6,905.96. The main one being the fourth quarter unemployment payment to TAC.
Move, we approve the late bills.
Second.
Motion been made by Commissioner Letts, seconded by Commissioner Harris to pay the late bills as presented. Any discussion? Those in favor, raise your hand or say aye.
Aye.
Unanimous, 5-0. Auditor reports.
Yes, the auditor's office conducted an audit of the jail commissary and inmate trust accounts for year ended 9/30/2020 and issued reports to the sheriff. Based on the testing procedures performed, expenditures and revenue are supported by adequate documentation, and purchases were made in accordance to the requirements of local government code, section 351.0415. Upon the court's acceptance, the reports will be sent to the Texas Commission on Jail Standards.
We're going to approve the board trustee.
Not only jail staff, but the auditors did find one, but again, there's another AG thing. Last year, we made quite a bit of money off the inmate phone system, our revenue part. And last year, they divided that out, that if it's paid for by the inmate out of his, deducted from his commissary, then the jail gets to keep that, that goes into our commissary account. If it's paid for by a family member, putting it on a credit card, then that goes to the general fund of the county, okay? Which is a pretty sizable amount, so we've been doing that all year since the UAG. Now there's another one that says it doesn't matter where it comes from, it all goes to general fund of the county. So from now on, the county will be getting in excess of $50,000 a year to the general fund. Just from the inmate funds.
Thank you, Morris. We appreciate it.
This is not a limit where you can,
Yeah, it will cut down on what we have to spend on certain items from the commissary account, because we just don't have the funding. So either way, it's gonna, it allows y'all to use it for different uses, but it's gonna require more county funding on certain items for the jail.
so it'll increase your budget.
Good. Not mine.
Do we need a motion to accept the auditor's report?
He made the motion.
Okay.
You did already, didn't you?
Okay.
I'll second.
Motion by Commissioner Letts, second by Commissioner Baloo to approve the auditor's report as presented. Those in favor, raise your hand or say aye.
Aye.
Unanimous. Accept monthly reports.
Yes, October 2020, Constable Monthly Report, Constable Precinct 3, Ken Wilkie. Indigent Services, HR Director Jennifer Doss. November 2020, Constable Monthly Report, Constable Precinct 3, Ken Wilkie. Certificate of Completion of Continued Education, County Clerk Jackie J.D. Dowdy. Treasurer's Monthly Report, Tracy Solden. And Indigent Services, HR Director Jennifer Doss. I move for approval.
Second.
Motion's been made by Commissioner Harris, seconded by Commissioner Letts to approve the monthly reports as presented. Those in favor, raise your hand or say aye.
Aye.
Unanimous. Court orders.
Yes, we have the court orders from December 14th, regular session, numbers 38479 through 38500. They all look to be in order. I'll make a motion to approve.
Second.
The motion's been made by Commissioner Letts, seconded by Commissioner Baloo to approve the court orders as presented. Those in favor, raise your hand or say aye.
Aye.
Unanimous.
You have a report?
I note that I skipped, is Bobby out there? Is Bobby out there?
Reed?
No.
Gordon?
Yeah. I skipped over, I forgot about the addendum. Item 1.17, consider, discuss, and take appropriate action for the court to cancel a public hearing set for January 25, 2021 at 10 a.m. and waive planning oversight for revision of plat for Riverbend Estates lots 8 and 9. Yes, sir.
2 weeks ago, the request was made to set a public hearing. The proposal is in the city's ETJ. In fact, it's about 350 feet from the city limits, just right across the river. This proposal combines Riverbend Estates, lots 8 and 9, into lot 8R, which will be 6.9 acres. Access is from Ward Road. It is completely within the floodway and must meet requirements for development within the floodplain. It is within Kerrville's ETJ and would typically be platted through both the city and the county. The city of Kerrville is unable to waive their platting oversight. Therefore, this agenda item is a request for Kerr County to waive platting oversight to the city. Although platting oversight would be waived, signature blocks for both the Kerr County Floodplain Administrator and OSSF designated representative would be required. Again, 2 weeks ago, the public hearing was set for January the 25th. And so the county engineer requests the court cancel a public hearing set for January 25th of 2021 at 10 a.m. and waive platting oversight for a revision of plat for Riverbend Estates, lots 8 and 9, waive that to the city. That's volume 5, page 377, precinct 2.
So moved.
Second.
Second, but I have a comment also, Judge.
Well, motion's been made by Commissioner Moser, seconded by Commissioner Harris. And any discussion?
Yeah, we received an email from Eric Ashley early this morning related to this, and I think he would like it to be read into the record. I hope everyone had a great Christmas. I did not intend for this be such an issue. However, it is obvious to me that the county is more than willing to work with the city on such issues of dual jurisdiction, but the city seems to lack the ability or willingness to allow the county to take leadership on such a minor replat. Thanks to everyone for their assistance. I'll restart the process with the city.
I'm glad he did that, because I was gonna ask Bobby. Didn't put him on the spot.
And
They just won't wait, really.
I question that they don't have the ability to waive. I think city council clearly has the ability to waive. They choose not to, and this is the reason we can't come up to an agreement with the city on how to handle the ETJ. They refuse to give up any of their rights, and I think that, other questions? I do have a question on this, what's the size of this?
Both lots are about a little over 3 acres. So the combined of the two lots would be the 6.9 acres. And what I understand is the city will typically waive anything over 5 acres, but because these lots are existing lots under 5 acres each, they're not able to waive based on the 5 acre rule that they have.
Anyway, it is what it is, and it's not working there, it's moving forward. Move forward.
Well, but now the public knows sometimes, well, we have issues with the city. We wait, but they won't. Any other discussion? Okay, those in favor, raise your hand and say aye.
Aye.
Unanimous.
Thank you all.
Okay, quickly, let's go through the information agenda. Any status reports from department heads? Any status reports from elected officials? Kerr?
Just to say thank you. My last meeting that I will attend, so I appreciate all the years of working with my office. And sometimes we didn't always agree on everything, but I think...
Mask off.
Why? Not yet. I think you'll see that I kind of lost my razor. Haircuts are, so things are fixing to change. My chief deputy did the same thing, so.
Oh, my goodness. Those hard line rules that you've been enforcing all these years.
Yeah, all those policies, now I just broke them, but, we truly do claim, I both truly appreciate what the court's done for that department over all the last 20 years at least. And, like I said, we don't always agree on everything, but I know and always understood that y'all had your duties and I had my duties, and we worked together to make them work the best they could for each other, and I appreciate that.
I have one request. Don't change your phone number.
No, that phone number is mine. Actually, I've never had a county-owned phone. That is the phone number I've always had. One I carry is a personal phone, so it's still there, so it will work as long as I don't throw it through. That could happen.
Well, I would like to say that I appreciate that no matter who you agree with or disagree with, that you've always been respectful to everybody and cooperative as much as you're able, and that's not as common as it used to be, and I appreciate it.
I think that's the key to it. Like I said, just even with Clay and I, we said it never ruined a friendship. We disagree a lot, but I never wanted somebody that just said yes. You don't get both sides, you don't get the whole story, you don't get to understand it all. And y'all had your duties, I had mine, and I think we can all, stand up for what we have to do, even if it's disagreeing with the other one, but we can still go eat lunch afterwards. And that's the way it should always be.
And we've always had each other's back. And we
Yeah.
appreciate that, Sheriff.
Yeah.
We do.
Yeah, Russ, I appreciate your friendship over the many years. And I really appreciate one of the things that you've done, and hopefully the area will continue it, is that when something happens in any of our precincts, you take the extra time to call the commissioners and say, hey, there's a bad wreck, so there's been a fatality, or there's been a fire, or whatever it is. That extra little bit, it does help. It helps
Sure.
communication. It helps for us to know what's going on in our areas, and you've been really helpful to that.
Well, and I've already explained that to Larry, because I do think that's important. Because just like his phone rings, when something happens in the county, your phone rings when something happens in your precinct. And I think you have a right and should be able to be up on, most things that are going on, so that you have answers to your constituents too. So, but I appreciate it. Thank you very much.
Thank you.
See y'all later.
We'll see
We're
you.
gonna miss you. Okay, Any status reports from liaison commissioners?
I have a question, and Rusty, don't believe it, you don't believe it. The question, it goes to our sort of liaison. What's the question? Anyway, it's really not liaison. I'll give it up the other part. It's about how we're gonna do Friday's deal with the social gathering. And the swearing in, and it becomes because the deputies all need to be there. Do you know how Larry's planning to handle?
Larry has talked with the judge, it's gonna be at the end, it starts at 10 a.m., but I think his swearing in is gonna be at the end of it, and there's enough room out there to socially distance the deputies coming in and wearing a mask and that, so that, you know, the judge that Larry has chosen to swear him in will swear him in, is my understanding, and then Larry will swear in all the deputies at one time. It's not the whole 116 member staff at the sheriff's office. It's only the sworn peace officers that have to be sworn in. So, you know, and there's a few of them that are out, either quarantined or, you know, on vacation, so you don't have all that. And it's probably close to 50 to 60.
What is the process if somebody can't pay them?
Then when they get back into town, Larry will swear them in, just like I would
any
in the
elected?
place.
All electeds? If somebody's sick?
The newly elected ones have to be sworn in at that. What the process is, and that's why the weather kind of bothers me Thursday. They're saying we could have snow or ice. Okay, whatever you do, please don't postpone that 10 a.m. judge, because unfortunately, whoever is already in that office, such as myself, if something happens and Larry can't be sworn in at 10 a.m., what it is the current one in there is still responsible. I'm still responsible. I'm still the sheriff until he actually takes that oath. And that's the way it works for all of
The
us.
existing office holder holds over until the
Yeah.
new replacement.
Until the other one's been qualified, which is taking the oath.
Your re-electeds have to be sworn in?
Yep.
Yes. Yeah. And then the deputies, once Larry is sworn in, all deputies commission is under the sheriff. So he has to swear in all those deputies. And there's some that are on vacation, so as soon as they come back, or for whatever reason they can't make it, then he will swear them in there at the office immediately instead of coming back into town, so that they'll have the commission.
And so that the public understands, the swearing-in ceremony will be at the Youth Event Center at 10 o'clock this Friday, January 1. And they've made arrangements to have everybody socially distanced apart. And when we talk about the sheriff deputies here at the end, I worked with Larry Latham on this. Is they're going to come in at the end, and they're going to, just like we did in the Army on the dress right dress, they're going to get socially distanced apart. And for the public, if you've never seen them assemble for a swearing-in ceremony, I'm telling you, it is an event. But we'll be at the end, so there'll be the least exposure for everybody. They'll be sworn in, and then we'll conclude the swearing-in ceremony.
Thanks.
Okay. With that, it is 10:57, and let's take about a 5-minute break, or 3-minute break, whatever it is. Come back about 11. We do have an executive session item in consultation with an attorney that will take up at that time. Yeah, does the rest of the court know what stock show's doing? In a minute.
The district show was canceled.
Huh?
The district stock show was canceled. County will go on. Well, I'll probably read it in. We get a lot of following on here, help clear it up what they said.
Do we have Jackie on the line? Do we need to get her on the line?
I don't know how, I think she's just following it. She's not on.
Yeah, I think she's
following
just
us on
watching.
Okay, good. Well, Jackie, we're assuming you're on the line. We're gonna come back to order. It is 11:26, and the court is out of executive session. I think there's one action item, following the executive session. And I'll make a motion that we go ahead and approve the resolution approving the state of Texas and Texas Political Subdivisions Opioid Abatement Fund Council and Settlement Allocation Term Sheet.
I think we need to let people know a little bit more about it.
We can't talk about it until we have the motion. So I got a motion and I got a second from Mr. Blue. And now we're open for discussion.
Well,
I'll try to give a quick overview, and our attorney can.
there you go.
A while back, there was Kerr County joined I won't say it's a class action type lawsuit against the opioid industry, and we've been represented by Jay Henderson. We pretty much have gone along with what the Attorney General of the state of Texas, and he kind of lead on a lot of this litigation against the drug companies and distributors on opioid medications. And we have a resolution, subject to the motion that was made, to go along with what the Attorney General of the state of Texas, Ken Paxton, and others are recommending as a resolution to that lawsuit. Kind of the first step, and it appears Kerr County will get a percentage of funds that the state of Texas gets. The amount is to be determined, and those funds will be used to address local opioid addiction issues.
I think that's very well said. I don't have anything to add. There's obviously detailed information for anybody that wants it. They should feel free to review it. The bottom line at this point is this is an essential next step. This does not obligate the county in any way to go through with the final step, although we will probably recommend it. But this is an essential step to get to the next level of the negotiation process.
Sounds good.
Okay, those in favor, raise your hand or say aye.
Aye.
Okay, unanimous, 5-0.
Okay.
Okay.
I hope everybody has a wonderful holiday, and all I can say is 2021 gotta get better, right?
Got to get in the rearview mirror.
Let's hope. Oh boy.
Okay, thank you, Jay.
Thank you so much, gentlemen, ladies.
Thanks a bunch.
Is there any other business for the court today?
Judge, it said last thing we can go back to liaison responsibilities and
Yes.
announcements. During the court today, the Hill Country District Junior Livestock Show issued a press release. I'd like to read that just for the public that is following this.
Jay, we're reading something into the record. Good.
Oh, sorry.
This is from Steve Bauer, the president. The Hill Country District Junior Livestock Show Association has been working diligently since early in the fall to restructure our county and district stock shows in order to meet the requirements for mass gatherings. On October 21st, the Texas Department of State Health Services recommended that mass gatherings not be held. According to President Steve Bauer, we believe we had a solid plan in place, but due to the expectation of increased COVID-19 cases, the state official responsible for approving our mass gathering application did not approve it. This leaves us feeling both disappointed and frustrated. However, we always knew that there was a possibility that this could happen. As a result, we will be canceling the 2021 Hill Country District Livestock Show. We'll be back in 2022 stronger than ever. Fortunately, with some restructuring, we will not have to cancel the county show. We will still have a county show followed by a county premium sale. Additional information will be posted at the extension office and through your ag science teachers, 4-H programs. But the main emphasis is the Stock Show Association felt that it is critical that we take care of our Kerr County kids. The Kerr County show will go on. The date may be adjusted slightly based on the Stock Show Association does, but it is, I know, a big disappointment to a lot of people that the district show will be canceled.
Well, I'm glad that the local kids, especially the seniors, will be able to have this show. That's a pretty big deal.
Yeah, I want to echo their disappointment. I know they weighed this very heavily and what have you, and you know, having been so involved in the district show for so many years, I feel for like you said, those seniors. You know, I saw some seniors in the spring that got, you know, they were odds on favored to be a state champions here locally, from a school here locally, and they got it kicked out from underneath them. I've seen these others, seniors, ready for a good year, and from the other counties, it kind of gets them knocked out. Also, you know, the new showers that have been looking forward to this first year I get to show in the district show, and now all of a sudden they can't. It's disappointing on so many levels, and all we got to blame it on is this China virus. So,
I know Gillespie County's gonna have theirs also.
of course,
so that's good.
county show.
The county shows are going on in most counties around us. It's the district show and the larger, Fort Worth canceled earlier this year, or in the fall. San Antonio, San Angelo, Houston, Austin, they're all up in the air. San Antonio is planning to have theirs, but it is greatly reduced.
Significantly.
And it may suffer more reductions based on what's going on. But we're probably the second big show, the first one in 2021 that will have to cancel and too bad. But hopefully our county kids will go forward, and hopefully we'll have a lot of people still attend the auction and look after our county kids.
And I want to specifically acknowledge Steve Bauer and the executive committee for the stock show. They have worked tirelessly and been in almost constant communication with me through this whole thing, because I do the mass gathering permit process. And they have been very sensitive and cooperative and are doing their dead level best to keep everybody as safe as possible and still have these kids have some positive experience from the stock show. And my hat goes off to them. So with that, there being no other business before the court, we are adjourned.